If you have a scheduled appointment for LASIK eye surgery, preparing yourself will ease your concerns and increase your chances for a favorable outcome. Eyesight is so important, and it's normal to experience fear and a little nervousness prior to surgery. The good news is LASIK is a relatively safe procedure. At the Dishler Laser Institute, their reputation includes exceptional patient care for the last 25 years. And they believe that great medical care means using the best technology, building strong patient relationships. As seen in Forbes as one of the top 10 LASIK surgeons in America and the first to perform LASIK in Colorado, Dr. John Dishler is Denver's LASIK expert with over 53,000 procedures performed. Well, Sarah Morrison is an employee of Dr. Dishler's, and she is preparing for her own LASIK surgery. Why? Because she wants to get it done before her big wedding in May. Congratulations.
Thank you.
That's wonderful. So, Dr. Dishler, what's the first step in preparing for LASIK?
Well, the first step is obviously coming in and meeting us, having a consultation, and learning what someone's options are, whether they're really a good candidate for surgery, what the pluses and minuses are. And then we do some special testing, of course. Besides a regular eye exam, we check a thing called corneal topography, wavefront analysis, corneal thickness maps, and pupil size. These are all things that will allow us to better evaluate the health of the eyes in a scientific way. And we discuss these tests with patients. They're totally, of course, pain-free. It's just a light sort of scanning the eye. And that helps to understand just how good of a candidate somebody is for moving forward with this.
So if you're thinking of LASIK, you have to call Dr. Dishler, 303-793-3000. We have a great deal for you. I'll tell you in moments. You can also go to dishler.com. Now, Sarah, you're an employee of Dr. Dishler, but you're also going to become a patient very soon. What are some of the biggest concerns that patients have when they call your office?
The biggest one is obviously if they're a candidate, but they also want to know the details, like what do I do with my contacts? Will I need my glasses after surgery? Just the preparation steps for it. And so that's always their big questions.
How bad is your vision right now?
The big E is fuzzy for me, so
Do you have to use contacts?
Yeah. Oh,
you do?
Yes. Oh, yes. I cannot drive. Yeah.
Think about how great it's going to be walking down the aisle. You don't have to worry about contacts that day. Just
I'm more excited for the honeymoon. I don't have to worry about the contacts then. Yeah.
All right. So what tips do you tell LASIK patients prior to the surgery? You really want to make it smooth. What do you tell them to do?
Obviously, take the day off of surgery and take the next day off. Don't put pressure on yourself to immediately return back to work. Also, try to get a good night's sleep. It's always hard when you have something nerve-wracking next day. But also try to eat something before coming to see us. That's a big one that people sometimes skip, and it's just helpful. It helps with the stomach, helps them relax a little bit. So.
Good. Dr. Dishler, take me to the day of surgery. What is it like?
Well, on the day of surgery, people are nervous. Everybody's nervous, of course. So it's important for people to know that we give them anti-anxiety medications, which really relax them, and we can give them just the right amount, not to knock them out or make them feel loopy, but just to take the edge off of things. It's also important to understand that we use anesthetic eye drops, numbing eye drops, to numb the eyes right before the procedure, so people feel virtually nothing while this is being done. And actually, most people feel pretty much nothing even afterwards as their eyes are healing, maybe just a slight sensation. And the procedure is completely done with lasers now. We use one laser to make the flap, which is the first step, another laser to do the actual correction. But the lasers don't really burn or anything like that. Sometimes people are worried about that.
Yeah.
They're very, very gentle, very precise. And almost everybody says they felt absolutely nothing during the time the procedure is being done.
Now, I have to tell you, I may have to come in and see you because most of the time I look at this camera, but then I have to look over here to actually see the phone number. So there's a sign that my eyes are starting to, uh-oh, something's going on. Is there anything else we need to know about preparing for surgery?
Well, you know, everyone should realize that by and large, if you're a good candidate for LASIK, and we do things right, which we work really hard to do, the results are just great. We publish the results and show it to patients what our results are for an individual's prescription. We take every possible safety measure we can. We work in a state-certified ambulatory surgery center. Once in a blue moon, somebody gets nervous and feels a little faint. We can give them some oxygen, things like that.
Good.
And we have complete control over the laser. Some people are a little worried that what if I move? They need to understand that there's a tracker on the laser that tracks the eye. And if for some reason someone needs to pause for a few minutes, we can stop at any point. So no one should feel trapped or anything like that. It's a relaxing experience, most people say. We even have someone as a hand holder to hold every patient's hand while
Really?
they're
Someone
having
to
this done.
actually hold my hand?
Yeah, someone holds your hand. And
It's nice.
and
Do I get to pick the person to hold my hand?
we'll,
I'm teasing.
we'll find you a good one, yeah.
What about after surgery, the follow-up and the care?
It's pretty straightforward, really. Afterwards, I check everybody personally after they're done with the procedure, and we make sure that everything looks good, and then we give them some drops. They don't have to buy anything. We give them a little kit that has antibiotics and some anti-inflammatory drops. We tell them to rest that day, try to take a nap, which most people want to do, and then when they get up, typically their vision's good, where they can see and watch TV and do things. Because of the medications and so forth, we say just take it easy that day, but by the next day, almost everybody can drive and go about their normal activities, get back to their normal life. There's certainly some things that we tell people, swimming and certain activities that might involve injuries to the eye, of course, to take a couple of weeks off.
Yeah.
Be a little careful, don't rub your eyes, things like that. We tell women, not to wear makeup where they could poke their eyes, mascara, things like that for about a week.
Okay.
But usually most people find it to be a very smooth,
relaxing, good.
Smooth transition. And I mean, one of the really rewarding things about this, and I think what Sarah's seen in the time she's worked with us, is that so many people, when they all come in for their one-day post-ops, everybody comes in at one day, it's just almost like a party. Everyone's so happy.
Sure.
And they're smiling and they can see.
They don't have to put contacts in or glasses just to see the alarm clock in the morning. We have some video here, and I want you to kind of walk me through and tell me what we're seeing.
Well, this is an animation of the procedure being done. This is the first step where the laser is using to gently separate the layers, the outer layers of the cornea, and make this very, very thin flap. It's not much thicker than a piece of paper, really. And then we gently lift this back. And this is the thing that really makes LASIK so great, because now we can treat the eye underneath the flap with another laser, and very precisely with the most modern lasers that you can really buy in the United States. We use the very best technology. We can reshape the eye in a way that doesn't give people problems with their night vision and things like that. And then the flap goes back down. This whole thing only takes a couple of minutes to do. And all that has to heal is that little seam at the edge. And the eye is the fastest healing organ in the body. A lot of people don't realize that. So it heals very quickly. And by the next day, you can barely tell that anything was done.
Sarah, are you nervous at all?
No, not at all.
Good.
Years of experience with him, and the technology behind it as well. I'm just excited. I'm like a kid in a candy shop. I'm ready.
And when's your wedding?
May 4th.
Oh, congratulations.
Thank you.
We want to see pictures of the wedding next time you come back. Okay.
Absolutely.
At the Dishler Laser Institute, their reputation really comes from exceptional patient care for the last 25 years. They truly believe that great medical care depends not only on using the best technology, but also strong patient relationships. The Dishler Laser Institute is offering exclusive, just for you, my friends, on Colorado & Company special. When you schedule your surgery by May 23rd, you'll save $300 off Dr. John Dishler's lowest guaranteed price for custom all-laser LASIK. Your consultation is free, and they do offer easy 24-month no-interest financing. Some restrictions do apply, including credit approval. Call 303-793-3000 or go to the website, which is dishler.com. That's dishler.com. Get out, enjoy the world around you, especially finally here with LASIK from Dishler Laser Institute. They paid for their segment today.